Make sure and look at the camera and talk about. Welcome, friends, to the Barriers and Breakthroughs show. I'm Rochelle Painbaum. Yes, that's my middle name. And I'm the pain whisperer. I'm a physical therapist, and I love to help people fix their pain. And a good physical therapist always helps you learn how to fix yourself. So if you have any kind of pain, make sure and Facebook message me. If you have my email, you can email me. You can text me. You can call my husband if you want, if you have his number. So, or my friends, just let me know. I would love to help you. It doesn't cost anything. A phone call is great. A text is great. So let me know. I would love to help you fix your pain. And today we have a super wonderful guest. This is our actual 50th episode, 50. Nice. So I want you to make sure and go to YouTube, because this is also posted on YouTube. We have 50 episodes of amazing people all over the world, from Nigeria, across the world, to the UN, to my friend Erica in New York City, plus a lot of people here in Houston and Pearland that you can learn a lot from. So, and especially today, you're going to learn something new from our wonderful guest, Dr. Serge.
Hi.
With Mind and Body Solutions, and it's great to have you on our show. Thank you for being number 50. That deserves
awesome. Congrats to you. Nice.
Yeah, thanks. Good. So Dr. Serge and I met each other at BNI, Business Network International, which I'll give a quick plug for that. If you're a business owner, that's a great organization to join to help you get your name out there and meet the right people to help you in your business. So we met 4 years ago, pretty much.
A long time ago.
And you were in it before me, right?
I was.
I joined your group.
I've been in Milan for 6 years.
Yeah, okay. So longer than me. Good. Longer than I. So Serge, he went to Harvard, right? And so, yeah, tell us a little bit about your story, where you're from.
Good.
Because I know you have a wonderful accent, and how you got here to Texas. Just tell us a little bit of your story, and I'll ask you some more questions.
Awesome. So yes, I'm from Quebec City. I was born in Quebec, and I moved to Boston 12 years ago for work.
Okay.
And as you can hear, I had to learn English, because in Quebec we don't really learn English. We learn Français. So we was mostly French over there. So I had to learn, and I did learn fairly good.
Yeah.
And a couple of years ago, I wanted to go south. I wanted to move south because I was sick of the snow in Boston, the cold and the weather.
Pick the right place.
Houston is wonderful. I like the heat.
Yeah.
Same. Good.
So tell me about your schooling, because you went to Harvard. So you decided to go to Harvard when you're up there.
Right.
And what did you study up there?
So first I did my Ph.D. at McGill University in biology, and at Harvard I did a fellowship for 6 years.
Wow.
On heart disease. My specialty is really the heart.
Heart disease.
Yep.
Very good. So yeah, I mean, all of us care about our hearts, right? We need to have our hearts working. So that's awesome. I did not know that. So you know a lot about the heart and utilize that in your practice.
Correct.
Obviously.
Correct. As you may know, heart disease is half of what's
number
going on
one,
all the time.
isn't it?
Yeah,
Number one.
Number one.
Heart disease is the number one killer, is what I meant to say.
Yeah, exactly.
For sure.
So we need to have a good education on how to have a healthy heart.
Yeah, very good. So tell me a little bit. So how did you end up with your own practice? Did you move here working for somebody and then start on your own, or how did you do that?
Actually, I had a practice in Boston.
Oh, you had a practice in Boston.
I had two jobs. I was working at Harvard Hospital, and I had an office on the side. And when we decided to move, I sold my practice and I opened my practice here.
Open here.
So yeah, good. 6 years ago.
That takes a lot of bravery, like starting over.
It was
and
hard
did you know
to do.
somebody here?
I had one friend living here in Pearland, so she was really good help. Yes.
Very courageous, in my opinion. Plus, learning the language, so.
It was challenging, but it's worth it.
Yeah.
I'm really excited. I'm really happy to help people.
Very good. So, okay, tell me a little bit about what you do. Why would somebody want to come here? It's different than most. It's not a regular doctor clinic where, I mean, he uses homeopathic. Well, that's not the right way to say. So
homeopathic.
Natural forms of healing.
Correct. Right. So we do a holistic medicine.
Holistic.
Right? So
that's the word I was thinking of. Holistic.
Holistic, which is more like natural.
And I speak English. Sorry.
That's okay.
Okay.
So we do alternative medicine. So we use herbs and homeopathic, like you mentioned. We use diet. So our primary tool is really the diet.
The
Okay,
diet.
so we look at the patient's situations and figure out a diet that fits their needs. Okay. There's just so many different diets out there, and people come to us, they're so confused.
Yeah.
So should I do paleo diet? Should I do keto diet? Or, I mean, all those different questions we have, and it's really case by case, depending where you are. So we really help the patient when they come in to fix themselves.
Yeah.
Okay.
Good.
So that's the main thing we do is we figure out why. Okay. When you go see your medical doctors, typically there's not a lot of questions about why.
Yeah, that's a good point.
So we try to figure out the root cause of your issues. Why you have migraines, why you have high blood pressure, instead of using a pill to mask it. Okay.
That's exactly true. I was just talking to my husband about how with high blood pressure, like a lot of times the medicine they give just masks what the real problem is.
Correct.
Right. So that's important. That's really key.
Important. Yes. And everything can be addressed and fixed with diet. Wow. Okay. Like high blood pressure is typically a magnesium deficiency.
Wow.
So instead of taking a pill, take some magnesium, for example.
Okay.
Could be really simple.
Yeah. That is interesting because of our industry, there's a lot of drugs that are getting pushed, the drug industry especially. So did you learn any of that growing up, like in Quebec,
No, actually I was going to medical school. That was my primary goal, to be a medical doctor. And like most of us in this field, I had my own issues. And my issues didn't get resolved when I saw my colleagues, my medical doctors. So I started to question their approaches and the way they were doing things. And myself, I was taking several medications for blood pressure, for cholesterol, for pain, and so on and so on.
If you're in medical school, you probably have high blood pressure because you're so stressed.
It was really stressful for sure.
Yeah, that's hard.
But still, I was taking 3 or 4 medications for blood pressure, and it was not going down. So there was something going on, and my colleague couldn't answer me. And I started to do my own research on natural diet. That's how I came to this field, actually.
Do you think it was what you were eating?
Yes, it was.
What were you eating, like McDonald's or what?
Being in grad school, medical school is junk food.
Junk food.
McDonald's, fast foods, pizza, burgers, pasta. That was my diet for years and years and years.
Wow.
And you cannot sustain on a diet like that. At some point, your body breaks down and you have issues.
Yeah, that makes sense. Yeah. So, what about who's your primary client and how do they hear about you generally?
My primary client, they are women.
Mostly women. I know you have. I've known people that come through here. Most of them are women. Yeah. Not everybody. I've known a few men that have come through. But...
Yeah. I say women because usually women are more in tune with the body, with the health. They're more open to do nutrition and natural options.
Yeah.
We see anybody from newborns to 95 years old, whatever, but women, 95% of the time we see them. And they typically come because they have hormonal issues.
Hormonal issues.
So hormones are a big thing on the
women's scale.
Yes.
True.
So it's a big topic, and we help them with their diet.
Yeah.
And women usually are in charge of the household as well, right? In charge of the cooking and the shopping and the kids, and they're burnout, they're stressed.
Yeah.
And we need to help them, to help everybody else.
Thank you. Yes, sometimes it's very hard.
It is. It can be really difficult.
I saw you do a seminar. There was something that caught my eye. It said the 3 most common causes that professional women.
The main mistakes.
That's what it. 3 common mistakes professional women make that they try and cure anxiety, stress, and something else.
Yes. I think the main thing is most of the women will go see a doctor, and they typically prescribe an antidepressant. Okay, you're tired, you're stressed out, take this pill, you sleep better, and so on. But most of them come back to us because they don't feel better. They feel worse at times because antidepressant have side effects.
Yeah.
Okay, and the main one is antidepressant leads to B deficiency. And you need B vitamins to help with stress.
Yeah, exactly. Your B complex.
Yes, exactly. So usually those women on antidepressant, they get worse over time.
Very interesting.
Okay, until we address the B deficiency.
Yeah, that's good because I fortunately haven't had to deal with depression, but sometimes I have hormone cycles,
Yes.
And sometimes I feel stressed, so I take the Mega B complex or whatever, and I notice it does make a difference. I cycle those, so I didn't know that though about the medication. So
it's crazy. Most people don't realize that medications cause deficiencies in the body.
I think, isn't it because this is what maybe you could answer this. If you're taking the artificial medication that your body's supposed to produce, then your body stops producing altogether.
Yes.
Isn't that true? Is
Correct.
that the main reason why?
That's one of the main reasons. And those medications would compete with vitamins that people eat from food.
Okay.
So there's a competition in the gut, in the body, and the medication would win, and the body's not absorbing the nutrients.
The real nutrients.
The real food.
Wow. Very good. So you also teach women how to eat. Is that right?
That's our main thing, is teaching people what to eat and what to cook as well.
And what to cook.
Because a lot of people, unfortunately, today are busy. They don't take the time to cook. So you have to help them with that.
Yeah.
Okay. Or help them with the shopping, what to buy at the store.
That's really great. That's exciting. I would love to come in and try it out and see what I'm missing, And how long do they just come in and get an assessment done in an hour, or how does the assessment go? Do they have to come several treatments, or? Good question.
How does that? Usually the first assessment is about an hour and a half.
Okay.
We talk, there's some forms to fill out, of course.
Yeah.
And we really figure out why you have certain issues. Okay. And then based on that, we come up with a plan of actions. Okay. And then typically you come for follow-ups. Okay?
Yeah.
Usually to help with the diet change.
Yeah. See how you're doing.
Correct. Check on you if you have any questions and help you with some tips and foods and what to buy, what not to buy, and so on. Okay. There's a lot of education in what we do.
Yeah. I read an article the other day, and it was interesting because my friend did an allergy test, and she had like hundreds of things that she was allergic to that she didn't realize, even though some of the food, like ice cream or milk products or even gluten, she knew it didn't make her feel good, but so it was a Groupon, she decided to do the allergy testing.
Yes.
And sure enough, those things that were on her list were the ones that she didn't feel good eating anyway. Yeah. So do you do kind of some allergy testing?
That's a good point. That's one of the things as well we do when you come for the first visit. So we look at food sensitivities.
Food sensitivities.
Like gluten is a big one you mentioned. Milk is a big one.
Yeah.
It can be soy. It can be anything. So that's really part of the program, right? And we design a diet based on those food sensitivities. If you're gonna have A's, okay, let's work something out. So on and so on.
Very good. Yeah. So you actually do the allergy testing.
We do.
That's important. Okay. Yeah, because I have 8 kids, and so my youngest is the only one that was allergic to milk.
Really? Okay.
And so my husband's worried that he's not growing fast enough because he hasn't had regular cow's milk and has to have almond milk or something that doesn't really have a lot of protein necessarily.
Yeah.
So anyway, I'm kind of curious what things he can eat that are some dairy if he can, because he can eat yogurt. It seems like that doesn't bother him, but
it's possible.
But you can test a 5-year-old.
Or we can test babies. We have newborn babies actually.
Oh, wow.
And we can test them because sometimes the mom has issues when they're pregnant, right? So the baby sometimes they're born with deficiencies and some food issues.
True.
So we look into that as well for those cases.
Yeah, because like one of my daughters is really picky. She just doesn't like textures or certain foods. She doesn't like fruits or vegetables. But she says it's a texture. She has geographic tongue.
Yes.
So I don't know if that's related to some allergies or something. So I should have her.
Could be an allergy or most likely a deficiency.
A deficiency.
Yeah, that would cause that. Oftentimes it's zinc actually.
Zinc.
It can be really simple.
Oh, okay. I'll have to tell her.
And a lot of kids are deficient in zinc. Yeah.
That's so good. That's so important because you've heard of these vitamins, but you really don't know how they're used because nobody tells you. It's just like buy multivitamin and
you don't really know.
Yeah, if it's good enough or not.
You don't know if it's good, and you don't know if the vitamins are actually good for you because some vitamins are lower quality, right?
True.
So a lot of people are confused into what do I buy for vitamins.
Right.
There's so many different brands out there.
Yeah,
it's really overwhelming.
Confusing.
Yeah.
So you do the follow-up. I had another question about, I also read about the pesticides. There was an article about gluten intolerance, but something called glyphosate intolerance that has to do with Roundup, which is a pesticide.
Yes.
So have you heard anything like that?
Yes, and I totally agree with that. Actually, that's what I see most of the time with people who come with wheat or gluten sensitivities. At the end of the day, that's a symptom. The actual cause is, like you said, the Roundup. When you eat foods that has the Roundup gets into the GI tract, right?
Right.
And it destroys the gut.
The regular,
the digestion, which leads to deficiencies.
Yeah.
The leaky gut that people
leaky gut, right?
Yeah.
Your microbiome is really important.
Right.
So
when you have Roundup in the gut, your microbiome goes away.
Yeah.
So we have to take probiotics to help with that.
Yeah.
Yeah.
I mean, really, this makes a lot of sense to me. So
yeah.
I'll definitely have to
look into that.
Yeah, look into it.
Yeah.
So, and you're in the community. I know you part of the Chamber of Commerce. I saw, I think it was on your Facebook. You're part of the chamber.
Yeah.
Okay.
Yeah. We try, like I said, our goal is to educate people. So we do a lot of outside talks and lunch and learn and seminars.
Right, that's what I was going to say. You do seminars or something. I've seen that.
Yeah.
Posted.
So people are confused when it comes to the diet and nutrition. So our goal is to really educate them, to empower them with knowledge.
Yeah.
Okay.
Yeah, so I see up here you have these little, I know, here, maybe I'll turn it. Is this bad? Ooh. You have these bile things. Okay, we're back up, I think, straight, hopefully. Okay. And,
Good.
okay. Yeah, what, I'm curious about some of your, you drink stuff that's really, really healthy. I know. I'm really interested in that. Is it
Yes.
herb based or what? These look like herbs.
So these are all herbs and vitamins.
Okay.
So we use
That's
a
a
lot
lot
of
of
herbs. We
Wow.
have more than 500 different herbs and products in the office.
Wow.
Okay, because people come to
500.
us with all kinds of
See the
different
question.
issues. Okay. And these are samples of different vitamins, and these are food-based vitamins.
Okay.
That's what I said earlier. Some of the supplements you get outside are synthetic. They are fake vitamins.
Oh.
And you don't
Fake vitamins.
really
That's
know
a new word.
what
Okay.
people take.
Yeah.
Okay, and these are food-based, so meaning they are concentrated foods like broccoli, kale, and apples, different things, really potent pills.
Right.
And based on what the patient needs, we use these different supplements.
Yeah. Because
Okay.
I do know from personal experience also, there's a lot of antibiotics I always get prescribed. I know
Yes.
that messes up your
Yes.
gut or your natural flora of your stomach.
Correct.
So you know how to kind of help fix that
Yes.
as well.
We
Yeah.
help that to see what we need to do
Okay.
with
So-
the gut microbiome.
We did have a question on Facebook. So what do you tell a drug taker that takes prescription drugs how to get off it? Do you wean them off before they start taking supplements? What if somebody is taking, medicine, for whatever the doctor prescribes them,
Yes.
and they think they have to keep taking it, or they might feel like they have to, even like antidepressants as well. You wean them, you know how to wean them off, or do they just go right cold turkey and start taking your supplements?
That's a good question. The way we do it is we recommend vitamins to them first. We figure out why they were prescribed medication first. If you
Okay.
were depressed and antidepressant, okay, so why?
Yeah.
So we fix this issue, and then after a while, you wean yourself off the antidepressant medications.
Okay.
So we always have to figure out the root cause of the issue first. Because if you stop your medications, you might go back feeling depressed and
Yeah.
having pain and all those different problems. Okay.
Yeah.
And most of my patients who come to us, actually, there's a point that we do that.
Then you do wean
You
them
just
off.
wean them off. And you shouldn't take medication if everything is well in your body. Right?
Yeah.
That's
Right.
the idea.
Right. Not
And we help people with that.
right. Very interesting.
Yeah.
Also, if you're eating well, you don't need to take as many vitamins if you're eating the right
Yes.
kind of foods.
Correct. That's why we're really
So,
big on diet, nutrition, education.
Yeah.
Because you need to take your vitamins from food first.
right. Now, there's a lot of herbs, 500 herbs. So how did you study them up?
I did.
Like, now, are you an herbalist?
I am.
As well. Okay.
Yes. Herbalist, nutritionist, holistic doctor.
Yeah.
So we do whatever we need to do to help people.
That's really awesome. I mean, plants and herbs and that really are fascinating
It's
to me.
fascinating. And
Yeah.
people don't realize that most medications are actually derived from plants,
From plants.
from
Yeah.
herbs.
Yeah.
So why not using the herbs instead of the
Itself,
synthetic pill?
because it might be added with other stuff that's not
Yes.
good. That
Having
might
the side effects.
ruin the
and-
effect of the good effect of it,
Yes,
possibly.
correct.
Have you traveled much learning in different plants or
I didn't travel much. I learned in school.
just school?
Yeah,
Okay,
just
so
schooling.
where do you get your herbs from? Do you get them from a
From-
specific place?
From Australia and from the States.
Oh, okay.
Australia has really good quality herbs. So they're really big into
Okay.
herbs. Yeah.
That's good to know.
Yeah.
Australia. Cool. Maybe you'll have to go over there one time.
I would like to. We'd
Yeah.
like to go.
You're so busy that you probably can't get away, but
That's the problem.
Yeah, that's a good problem to have.
Exactly.
Okay. So most people would get a hold of you looking at your website.
Yes.
Yes.
We have a website, we have a Facebook, we're really active on Facebook. Again, we educate people,
Okay.
share articles and different knowledge on diet.
Yeah. Okay. And so they can just contact you even on Facebook if they're
Facebook,
questions.
emails, phone numbers,
Yeah.
text. Yeah.
Do you have an upcoming seminar that you wanted to promote that's upcoming?
We do actually. This coming Friday.
Oh.
We have a cooking class. Actually,
nice.
I was talking about cooking. Sometimes people need some help with cooking and ideas. Okay,
Yeah.
what to eat. So that's actually the title of the workshop this Friday is what to eat.
What to eat. Okay.
So it's a cooking class. We're gonna cook some foods and eat. Okay.
Cool.
And in 2 weeks we have a workshop on weight loss. Why can't I lose weight?
Okay.
I hear that all the time. People try different diets and different things. They cannot lose that weight.
Yeah.
Why is that?
Oh yeah.
So there's a reason for it.
Cool. Okay, so that's in 2 weeks. If you've ever thought, why can't I lose weight? That's 2 weeks.
Correct.
On a Friday, what day?
Tuesday.
Oh, on a Tuesday in the evening?
6 o'clock in the evening.
Here. And they have a nice salon up here in the front where they have chairs and a great TV screen for putting up information. So it's a very good educating place to come as well.
Correct.
Here it's in Friendswood, right?
It is in Friendswood.
Yeah.
45,
Off the 518, 45 is pretty easy to get here.
Correct.
Another question. Oh, so it's tomorrow night. That's Friday, tomorrow night.
Friday, it's tomorrow night, yes.
Okay. Because my husband and I go on a date, so I'm like, okay, that would be a great date to come over and
Why not?
Learn how to cook together. Because he likes to learn about holistic medicine and so that would be great for him to come as well.
That would be good.
Idea.
We're gonna talk about diet and food.
Yeah, that's great. Okay, well, I'm so glad to have you on.
Thank you for having me.
Yeah, make sure and tune in for if you feel like you just can't lose weight and you've tried a lot of things and it's not working. 2 weeks on Tuesday.
Sure.
Mind and Body Solutions. Just go to Mind and Body Solutions with Dr. Serge, and we're going to try and come tomorrow to the cooking class.
That'd be awesome.
Yeah.
Awesome.
One quick question. I also have one more question. So, if you have to buy food from the store, right? So if all these stores are still getting all their food from pesticide products, like I've had a garden before, but I can't grow all my own food and kill my own animals and whatnot. So is there a specific place you like to go to that you recommend for buying food?
Sometimes I go to Whole Foods, right?
Whole Foods.
Trader Joe, I'm a big fan of it.
Trader
Good
Joe's.
food.
Okay.
H-E-B, that's where I do my shopping.
Okay.
I try to buy organic as possible when we find it.
Okay.
Yeah.
So organic.
That's a challenge sometimes. But,
okay. Is organic really organic? I've wondered about that.
That's the question that we don't really know at the end of the day.
Yeah.
I mean, there's quite a bit of studies that show that it's better to buy organic, but what you get, you don't know.
Yeah,
you know?
exactly.
If it says organic from China, I would question that, you know. So
all
I would
the way
try to
across
find
the
out.
boat, yeah.
Yeah, exactly. So I'm not sure about that.
Fresh.
Okay. So something more fresh and go to farmers markets. There's a few
farmer
around.
market. Yeah, actually.
There's a few around.
Froberg's. Have you been to Froberg's in
Yes.
Alvin?
They do have fresh
That's
foods
a
over
great
there.
idea.
Yeah.
Okay.
There's a few around if you look.
Yeah.
So that's the best.
Seasonal too.
Correct.
So.
Yeah.
Well, great. Well,
Awesome.
Thanks
Good.
so much.
Thank you.
Yeah,
I appreciate
it's
it.
good to have you
Awesome.
on here. So hopefully you'll tune in to Mind and Body Solutions. Come over. They can just walk in. Do
You
they
can
need
just
to
walk
call
in.
and make an appointment?
Yeah, that's always the best.
Okay.
So people come in, call, whatever.
Make an appointment.
Yeah.
And they're open pretty late, even after business hours, because we're here at 8:00 p.m. and they took their last patient like 7:30.
Yes.
So
we work late because
Serge
people
works
work.
really hard, and a lot of you have work to do and businesses to run. So even after work, you can still come in and get some awesome experience and education from Dr. Serge. So. Great. Well, thanks so much.
Thank you again.
And Mind and Body Solutions, Dr. Serge will be coming in. I'm going to come to this cooking class tomorrow. I think we have
Looking forward to see you.
Open date, so that'll be awesome. All right. So I'm, again, Rochelle Payne-Baum, the Pain Whisperer, here on the Barriers and Breakthroughs show. Don't forget to go to YouTube, Barriers and Breakthroughs. You can look at all of our past episodes. Dr. Serge is number 50.
Nice.
Super awesome. And we also put some highlights and everything up there. So YouTube channel. Don't forget to go there, share it with your friends, subscribe. We'd love to have you learn a lot from all of our wonderful guests that we've had on. So tune in next week, and always Thursday evenings at 8 p.m. on the Barriers and Breakthroughs show. We should have John and Jennifer Kahn, who is a personal injury attorney. You can ask them a lot of great questions. That's next week on Thursday. So have a great week. Come in and see Dr. Serge, and I bet you'll learn a lot and help yourself be a more fit and healthy and happy. So
thank you.
Have a good night. We'll see you later. Bye.